Today we will study about the obturator nerve. Okay, so if you have any doubt, you can ask during the lecture class. So actually, you have studied about the femoral nerve and about the sciatic nerve, right? Now, this will study about this obturator nerve. It is also very clinically important, and this obturator nerve actually it arises from the plexus, right? Like your brachial plexus. Here you will find another plexus, right? So that is the lumbar plexus. Okay, so it arises from lumbar plexus. Okay, so how this lumbar plexus forms? See, here you just write the T12, okay, spinal nerve, L1 spinal nerve, L2, L3, L4 and L5, right? So from the T12 spinal nerve, one nerve is arising, right, in this way, right? The T12, what will get? We'll get the subcostal nerve, right? Like your subcostal artery and vein. From the T12, you will find the subcostal nerve, okay? And from the L1, you will get the L1 spinal nerve. And this L1 spinal nerve, it merges with the subcostal nerve, okay? Then they divides like this, right? So the above will find one nerve and below will find another nerve, right? So this above nerve is known as your iliohypogastric nerve. Iliohypogastric nerve. Gastric nerve, okay? And below, whatever the nerve will find, this nerve is your ilioinguinal nerve. Ilioinguinal nerve, okay? So two nerves will find, okay? That means what? This nerve is your subcostal nerve. Then the subcostal nerve merges with the L1 spinal nerve. Then they divides into two as a iliohypogastric nerve, okay, and ilioinguinal nerve, okay, two nerves. Then here from this L1, okay, just come to this L2, okay, from the L2 spinal nerve. So draw the L2. So from the L2, one spinal nerve will arise, right? And from the L1, another spinal nerve will arise. Now they will mix with each other, okay? From the L1 spinal nerve rootlet and from the L2 spinal nerve rootlets, here you will find another nerve, okay? This nerve is known as your genitofemoral nerve, okay? This is your genitofemoral nerve, okay? Then this L2, okay? Then here you will find the L3, okay? Here you will find L4, right? And here you will find L5, right? So what will happen? From the L2, from the L3 and from the L4, Okay, all they mix together. Okay, they mix together, and here they will form another nerve. What is that? L3, L2, L3. Then here you will find the L4. Right, all these three will mix together, and here they will form your, what is that? Femoral nerve. So this is your femoral nerve. Fine. Now what will happen? From the L2 and from the L3, okay, another nerve will arise. Right? So this is another nerve. So this nerve is known as your lateral cutaneous nerve. Lateral cutaneous, Neous. Okay, lateral cutaneous nerve. Okay, so this is your femoral nerve, and this is your lateral cutaneous nerve. Fine. Now from this L3, okay, and from the L4, okay, from the L3 and L4, another nerve will arise. From the L3, okay, from the L4 and from the L2. Right, now I will give this one another color. Right, what is that? Here you see, from the L2 spinal nerve, from the L3 spinal nerve, okay, and from the L4 spinal nerve. Right, here it makes another nerve. Okay, now here whatever the nerve will find, right, so this nerve is your obturator nerve. Okay, this is your obturator nerve. Right, this is your obturator nerve. Now I got from the L2, L3 and L4 spinal segment, okay, we are getting the obturator nerve. Right, so here what we got? Now the obturator nerve, that is from the lumbar plexus, right, and it receives fibers from the anterior division. Right, this is your anterior division, okay, divisions of L2, L3 and L4. Okay, so after the obturator nerve formation, the obturator nerve, it descends through the fibers of your psoas major muscle. Right, so here you will have the body, right, of your L3, L4, L5, right, then you will find the S1, okay, then the coccyx. Okay, and here you will find the iliac crest and the ASIS like this. Okay, and here you will find the ala of the sacrum, and from this ala of the sacrum you will find the presence of your arcuate line, right, and here you will find ASIS, it is coming down, then AIIS, right, then it is coming in this way, and here you will find the symphysis pubis, right, and at this point you will find the ischial tuberosity, right, this is your ischial tuberosity, and this is your inferior pubic ramus, right? And here you will find this arcuate line that is just coming like this, no? So at this point what will happen, from the vertebral body, okay, and here what these are? These are the transfer process of the vertebra, right? So this is your L5, okay, that means it is L4, this is L3, right? This is L4 and this is the transfer process. So the nerve, which nerve, the muscle, I'll draw in blue color. Okay, so the muscle, that is the psoas major muscle, no? So the psoas major muscle, that is actually arising from the L1, okay, from the L2, from the L3, from L4, from the L5, right? So this is the muscle. Which muscle? Psoas major muscle, that takes origin from the L1 vertebral body and the transfer process, L2 vertebral body and the transfer process, L3 vertebral body and the transfer process, okay, like this. It is just arising from all the lumbar vertebral body and from the transfer process of the vertebrae and from the intervertebral disc, right? And this muscle, it is just coming downward, right? So this is your psoas major muscle, right? And you know that here at this point you will find the head of the femur, the neck of the femur, the apex of the femur, then you will find this is your body of the femur or the shaft of the femur, and here you will find the lateral condyle, the popliteal surface, medial condyle, okay, then this is your shaft, no, then you will find the head, right? So this is the position of your what? The femur and your hip, right? And at this point what you will find? The lesser trochanter, okay, here you will find this one is your greater trochanter, and here you will find the line, the intertrochanteric line, right? Now this muscle, it just comes downward, but below at this point you will find another muscle. What is that muscle? Here you will find a muscle. So this muscle is your iliacus muscle, no? This is your iliacus muscle. So the psoas muscle, that is coming downward above to the iliacus, okay, then the iliacus muscle and the psoas muscle, they will just unite together, okay, and they will make the tendon over here, iliopsoas tendon, and that attaches to the lesser trochanter. This is your psoas muscle, major, psoas major muscle, okay. So what happens? The nerve, obturator nerve, that arises from L2, L3 and L4, right? Here, and within the substance of the psoas major muscle, right? Within the substance of psoas major muscle, they unites with each other, okay, then they just descends downward, okay, in this way. So I'll make it something, okay, they just coming downward, okay, is the obturator nerve, and this obturator nerve, it has the close relation with the psoas major muscle, right? Now what will happen? This obturator nerve that descends through the fibers of the psoas major muscle, and it emerges at the medial border, okay, medial border of the psoas major muscle. Are you getting here? This is the lateral border of the psoas major muscle, and this is your medial border of the psoas major muscle, right? So this psoas major muscle, at the medial margin of the psoas major muscle, it is just coming downward, okay, towards the pelvic cavity, Okay, then it travels posteriorly to the common iliac artery, right? Means what you'll find here, you'll find your artery. Which artery? This is your which side? Right side. Here you'll find the left side, no? So at this left side you will find there is a presence of your what? Descending abdominal aorta, right? So descending abdominal aorta. Now this descending abdominal aorta, that will bifurcates into two, right, as a common iliac artery, right? These are the this is your what? Left common iliac artery, and this is your right common iliac artery, right? And this common iliac artery, again it will divide into two. Okay, what is that? External iliac artery and the internal iliac artery. Okay, so this is your internal iliac artery that is supplying to the pelvis, and the external iliac artery that is just coming forward in this way. Okay, then it passes through this inguinal ligament, right? Here you will find what? At this point, from the ASIS to the pubic tubercle, what you will find? You will find the inguinal ligament, right? So this artery that passes below to this inguinal ligament and comes forward, okay, as a femoral artery, right? So this is your what? The femoral artery, right? Now our concern is about this obturator nerve, right? So this obturator nerve that comes downward at the medial margin of the psoas major muscle, posterior to what is this artery? Here, common iliac artery, right? Here it is just posterior to the common iliac artery. Okay, then it comes downward along the pelvic wall, okay, towards the obturator foramen. Okay, this is your what? This is your obturator foramen. Okay, your obturator foramen. So this nerve that descends downward, okay, inside the pelvic wall, then here at this point, what will find this obturator foramen? It is covered by what? Obturator membrane. Okay, and here you will find a gap, right? So this gap is known as your obturator canal. Okay, so this nerve that will come downward near the obturator foramen, it is just divided into two divisions. Okay, it's just coming to the obturator foramen, it will divide into two divisions. What is that? The anterior division, okay, and we'll find the posterior division, the muscles. Okay, so here you will see that there is a presence of what is this muscle? Here you will find a muscle. This muscle is your pectineus muscle, no? Pectineus muscle to the pectineal line, from the pectineal line to pectineal line, right? Then here you will find another muscle, right? So this muscle that is coming from the body of the pubis, okay, and in this way, okay, so this muscle is your what is that? Adductor longus muscle. Okay, it is the adductor longus muscle. It attaches to your linea aspera, right? So what happens here? This nerve, okay, the obturator nerve, it divides into two divisions, anterior division and posterior division. Okay, this first we will study about this anterior division. So this anterior division, that is just in this way. This anterior division descends between your adductor longus and behind to it what will find? Adductor brevis muscle, no? Okay, just I will draw in another color for the adductor brevis. Mhm. See, at this point you will find the adductor brevis, right, which is hidden by this adductor longus. Okay, adductor brevis is the deeper muscle than the adductor longus. Okay, so in between the adductor longus and the adductor brevis, the anterior division that descends downward. Are you getting? This is the anterior division that descends downward in between the adductor brevis and adductor longus. Okay, towards the femoral artery. Okay, it will come downward towards the femoral artery. Femoral artery is present over here, right? Here you will find the femoral artery. So this femoral artery initially it is laterally present, but after that it comes downward and medially to reach at the adductor canal, no? So this is your femoral artery, right? So this obturator nerve that descends downward, okay, towards the femoral artery, right? And here it supplies the motor fibers. Okay, motor fiber to adductor longus, motor fiber to adductor brevis, okay, and motor fiber to gracilis. Okay, in rare case it also gives a motor twig to the pectineus muscle. Okay, what are these? It will give the anterior division, it is the motor supply to adductor longus to adductor brevis. Okay, to the gracilis. Okay, and to the, in rare case, in rarely, okay, to the pectineus, because pectineus also, what is that, innervated by which nerve? Who can say? Femoral nerve. Okay, so rarely it also gives innervation to the pectineus nerve, right? Now then what happens here, this, after giving all these motor branches, okay, the obturator nerve that actually pierces the fascia lata. Okay, it pierces the fascia lata, it pierces to fascia lata. Okay, when it pierces to the fascia lata, it becomes your cutaneous nerve. Okay, what is that? Cutaneous branch of the obturator nerve. Okay, now this is your cutaneous branch of obturator nerve. Okay, cutaneous branch of obturator nerve. So here the anterior division ends. Yes.
Here it comes out of the facial lata, right?
Yes, it is piercing to the fascia lata, going towards the skin and superficial fascia to innervate to that. Cutaneous means what? Sensory. Okay. So this is your anterior division, right? Now come to the posterior division, this one. Okay, the posterior division. Okay, so this posterior division actually it passes through a muscle, right? Here you'll find the obturator externus muscle. Are you getting the obturator externus muscle? Here the obturator foramen is over here. Okay, from the outer border of the obturator foramen, okay, and the obturator membrane, one muscle arises as a obturator externus, and that is actually going towards the femur, and that inserts at the greater trochanter, right? That is your obturator externus. So mainly the external rotator of the thigh, okay, or external rotator of the hip at the thigh level, right? So always be updated, okay, all these things are very important. So what will happen, this posterior division that will pierce to the obturator externus muscle, okay, this one pierces to obturator externus muscle, okay, pierces to obturator externus muscle, then it is travels anterior to your adductor magnus muscle, okay. Where is the adductor magnus? Here you will find the adductor magnus. Adductor magnus is from the ischial, what is that, this is your ischiopubic ramus, right? So it arises from the ischiopubic ramus, it arises from the ischial tuberosity, right? And some of the fibers adductor magnus that attaches to linea aspera, right, in this way. And some of the fibers, this is your adductor part of the adductor magnus that attaches to linea aspera, okay. And the hamstring part of the adductor magnus that is coming downward and attaching to the adductor tubercle of the femur, okay. This is your, here you will find a adductor tubercle at the above to the medial condyle of the femur. You will find a tubercle. That tubercle is your adductor tubercle, right? So the adductor magnus that arises from the ischiopubic ramus, from the ischial tuberosity, okay, and that fibers they arises from all these hip bone, and they are coming towards the linea aspera. So the adductor magnus has two parts. One is your, this one is your what, adductor part of adductor magnus, adductor part of adductor magnus, okay, adductor part of adductor magnus, clear? And this is your what, this is your hamstring part of adductor magnus, right? This is your hamstring part of the adductor magnus, right? And in between these two, here you will find a deficiency, right? This is the deficiency, okay. And this deficiency is known as your adductor hiatus, adductor hiatus. All of you are clear about the adductor magnus muscle and adductor hiatus? Okay, so through this adductor hiatus only, the femoral artery, the femoral vein, and the other, they passes through this adductor hiatus towards the posterior compartment of the thigh, right? So this posterior division of the obturator nerve that lies above to this adductor magnus muscle, okay, above to the adductor magnus muscle. That means what, the anterior division that passes in between the adductor brevis and adductor longus comes downward, supplies to all these motor components that I have already told you about, to the adductor longus, to adductor brevis, to the gracilis, and rarely to the, what is that, pectineus muscle. Then it pierces to the fasciolata, right, and forms the cutaneous branch of obturator nerve, clear? But the posterior division, okay, that is just lies above to the hamstring muscle, okay. It is first what, first it pierces to obturator externus muscle, right? Then it reaches at the adductor magnus muscle anteriorly. Okay, then it descends downward. Okay, and here it gives a branch to what is that a branch to adductor magnus muscle. Okay, that's why the adductor part of the adductor magnus, that is actually innervated by obturator nerve. Okay, but the hamstring part that you can see, okay, the hamstring part of the adductor magnus, that will be innervated by the tibial component of your sciatic nerve. So it has dual nerve supply. Okay, adductor part by the posterior division of obturator nerve, but the hamstring part is by the tibial component of sciatic nerve. Okay, that's why it has two action. One is the adduction action and another is your what is that extension of your hip, na, like your hamstring muscle. So it this nerve that innervates to adductor magnus. Okay, and it also gives a tweak to the obturator externus muscle, right? So what is that two motor, the posterior division, it gives motor to what is that obturator externus muscle. Okay, and another to the what is that adductor part of the adductor magnus muscle. The motor function will have the motor function. What is that? The obturator nerve, it innervates all the muscles of the medial compartment of the thigh. Okay, except the hamstring part of your adductor magnus. Okay, because this hamstring part of the adductor magnus, that is actually innervated by your what is that tibial nerve. All the medial compartment muscles, okay, what they are? They are the adductor longus muscle, okay, and adductor brevis muscle. What is the meaning of brevis? Short muscle, no? Adductor longus means a longer muscle. Okay, then it helps in what is that? It is anterior division. Okay, it is innervated by anterior division. Adductor brevis also anterior division. Okay, then we'll have the adductor magnus muscle, no? You please check the spelling, huh? Just I am written like this. Okay, adductor magnus muscle, it has two parts. What is that? The adductor part, okay, and another is your hamstring part. Okay, so adductor parts, it helps in adduction, right? It helps in adduction, and flexion of the thigh. Okay, and the hamstring part, it helps in extension of the thigh. Okay, so the adductor part, that is actually innervated by the posterior division of, okay, what is that? Posterior division of obturator nerve. Okay, but this one is by the tibial nerve, part of sciatic nerve, right? And this adductor longus, adductor brevis by the anterior division. Okay, then the pectineus also, sometimes it is by the anterior division. Okay, then we will have the gracilis muscle. Okay, it is also by the anterior division. Okay, and the obturator externus muscle, externus. Okay, this muscle is by the posterior division of, what is that, obturator nerve. Clear? So obturator externus, it helps in lateral rotation of the thigh. Lateral rotation of thigh. Gracilis helps in adduction of the thigh. Pectineus helps in flexion of the thigh. Okay, flexion of thigh. Right? So these are the motor functions of the obturator nerve. Okay. Now the sensory division. Okay, sensory. So sensory, that means the cutaneous branch. Okay, cutaneous branch, which division? The anterior division. Anterior division, it pierces to fasciolata. Okay, and supplies to, okay, supplies to, what is that, middle part of medial thigh. Okay, how is this? See, so here you will find your SIS, and this is your anterior, this is the lateral part of the thigh. Okay, and here you will find the medial part of the thigh. Right, now you will see that this whole, okay, this is actually innervated by the lateral cutaneous nerve. Lateral cutaneous nerve. Okay, where is the lateral cutaneous nerve? See, sorry. Okay, here you can see, no, this is your lateral cutaneous nerve from the L2 and from the L3, right? So it is by the lateral cutaneous nerve. Okay, then here some of the parts over here. Okay, here this is your anterior cutaneous nerve. Okay, branch of your femoral nerve, and all over this part. Okay, all over this part here, this is by the intermediate cutaneous nerve. Okay, branch of your femoral nerve. Okay, and here you will find this part. I'll give another color to it. Okay, this part is by the obturator nerve. Okay, here you will find you got another part over here, right? See this part. Okay, this part is by the genitofemoral. What is that? Genitofemoral. Okay, nerve. So this is by the genitofemoral nerve. Okay, because here you will find the scrotum over here, suppose. Okay, and this scrotal part, or in female the labia majora. Okay, the mainly the organ, no, sexual organ, along with this medial compartment of the thigh, upper medial part. Okay, that is by the genitofemoral. Below to this by the obturator. Okay, and this one is the femoral, this one is also femoral, but this one is your lateral cutaneous nerve. In this way your thigh sensory, that is distributed. Okay, suppose the patient will complain you pain at the groin region. Okay, this is the groin region medially. Okay, that means the patient has some problem at which region? See, you have to see the genitofemoral branch. What is that? L1 and L2, right? So if any compression will be there at the L1 and L2, then the patient will feel pain at the groin region, right? This region. Okay, if the patient will have any compression at the L2, L3, L4, then here will be the pain. Okay, if the posterior division of the L2, L3, L4, then that may be here, that may be here, or that may be here, right? Like this. So cutaneous innervation very important. Okay, so in sometimes what will happen, this obturator nerve damage also occurs. Okay, so this obturator nerve that can be damaged during the surgery, during the surgery of the pelvis or abdomen. At that time, what symptoms you will find? You will find numbness and weakness of the adductor compartment muscles. Adductor compartment muscle weakness, and you will find numbness at this area. Okay, numbness at the medial part of the thigh. Okay, and the patient may present to you that the patient may have the alternate gait posture. What is that? The walking pattern will be changed. Walking pattern. That is what? Walking pattern is known as the gait. Okay. So what will say? The gait problem will be there due to the loss of the adduction. Okay, and sometimes this obturator nerve can be blocked. Okay, by giving some anesthetic injection to the nerve, we can block the nerve. Why? For the management of pain after the lower limb surgery. Okay, and if the patient is having chronic hip pain, then also we can block the obturator nerve, because this nerve that is not only giving to this muscle, okay, and to the skin, but also this nerve also gives branch to the hip joint. Okay, so if the patient is having always chronic hip pain, then we can block that obturator nerve so that the patient will relieve from this hip pain. Okay, or what happens during the anesthesia injection? What we are doing here, you'll find the symphysis pubis, right? So we are giving injection. We'll just inject the anesthesia inferior to this pubic tubercle. Okay, here is the pubic tubercle here, and in inferior to this pubic tubercle we'll give the injection, right? So that will exactly reach at the obturator foramen and nearer to that obturator nerve. Okay, and and also what will happen at this point? You'll find adductor longus tendon also. No, so when you are inserting a injection with full of anesthesia below to the pubic tubercle to the adductor longus tendon, at that time you may touch to this obturator nerve. Okay, and that obturator nerve will be blocked over there by giving the anesthesia. So this procedure can also be carried out by ultrasound. No, through the ultrasound you can see where is the nerve. No, and you can inject that. No, particularly at that point. Otherwise, you just palpate the pubic tubercle. Below to that, you palpate the adductor longus muscle, then give the injection. Okay, for the obturator nerve block. So these two things are the only clinical thing you will find in obturator nerve.